If you are a new grad nurse, here are 26 things that you should do before January 1st, 2026. Number 1, and the most important thing, be kind to yourself. Number 2, do not judge yourself. Number 3, don't compare yourself to other people. That's a big one for a lot of us. Number 4, create a decompression routine. Number 5, I want you to learn to prioritize and nourish your mind and your spirit. Number 6, start a wins journal. In that journal, you can write down things that you did well. You can write down things that you advocated for your patient. Maybe you caught a clinical scenario early and was able to intervene and prevented any complications from happening. Write down also any recommendations from patients. Go ahead and start to create a wins journal. That will serve you very well. Number 8, schedule your own health appointments. So those are routine appointments that you have, dental appointments, GYN, annual physical, eye exams, all that stuff. Go ahead and start putting that on the list and prioritizing. Here's another thing that I learned from somebody online, I think Jesse Isler. Prioritize what is important to you, like dates that are important to you. So whether that's your mom's birthday or your child's birthday, your birthday, your significant other's birthday, prioritize those dates and then build your schedule around those important dates. Number 9, go ahead and create a student loan attack plan. What I mean by that is create a plan so you can fully understand your repayment options for those student loans, and then also how you can pay those down, a concrete plan on how you can pay that down. Number 10, start before you are ready. Whether that is starting your meds early, whether that is start applying for grad school, whether that is get out of the house earlier, right? Start before you are ready. It is going to be a skill that you build that will serve you in a lot of areas of your life. Number 11, start an emergency fund. Make it of importance to have at least 3 months of your monthly spending saved up, so you have that for you in case anything were to happen. You at least know that you are fully prepared. And usually research shows that it takes about 3 months or so for you to really find a job and get settled. As a nurse, it may be sooner, but you want to give yourself enough time, so have a 3-month emergency fund. Number 12, learn to negotiate. I heard a saying that says, you don't get what you deserve, you get what you negotiate. Number 13, shadow a partner. Whether that is a more seasoned nurse, whether that is a nurse practitioner at your institution, maybe a CRNA. If you're thinking about going back into those advanced practice roles, maybe it's a nurse who has her specialty, a critical care nurse, someone in the ICU, whatever it is, go ahead and shadow a partner so you can kind of see the daily routines for that person. Number 14, practice more therapeutic communication, okay, with your patients, with yourself. Number 15, utilize the teach back method, especially when you learn something new, right? The more you teach someone, the more it resonates with yourself. So if you're learning something new, try and go ahead and teach that to someone else. Number 16, master the pause. This is definitely something that I'm going to do. Master the pause. So make a commitment to pause 1 or 2 full seconds before you engage in talking about anything that's emotionally charged or something that is really visceral, right? Like something that is very emotional for you. Number 17, delegate with confidence and clarity. So that's going to help you with your time management skills, also help you with your boundary setting. So again, number 17, learn to delegate with clarity and confidence. Number 18, initiate a process of improvement, whether that is advocating for change on your floor, right? If you notice that the assignments are made at like 6:55, and by the time you come in as a nurse, you don't know what your assignment is, so that really pushes back your time in assessing your patients and getting started with your shift. Go ahead and maybe advocate to the nurse manager or to the assistant nurse manager or to the supervisor for more of a process improvement that would make things more efficient for you as a nurse. Number 19, start a professional portfolio. So again, begin collecting all these recommendations or even continuing education certificates that you get that you have to complete annually. Start creating a binder and putting those in there. Also, any quality improvement initiatives that you were a part of, any new software that got rolled out that you were a part of, go ahead and start building up a portfolio for that. Number 20, read more. Read more, whether that is fiction or more novels or even more evidence-based articles. The more you read, the better you become with your speech and your articulation, and also with your communication. Number 21, define your 5-year vision. So start to think about what your career would look like in 5 years, and go ahead and take some time to visualize yourself in that particular role. I would also encourage you to write it down as well. Make it plain so that your mind can help you in completing that goal. So whether you want to become a nurse practitioner or perhaps a travel nurse practitioner or a travel nurse, or some of us who want to, work from home, go ahead and start to define and refine that goal. Number 22, attend outside education workshops. So whether there are local conferences, I know at the institutions that I've worked for, they had it every year. They allotted about $600 of money that they would reimburse to you if you went to conferences. So go ahead and do that. It's a great way to collaborate and a great way to see nursing in other areas of the country and other parts of the world. Number 23, identify your first certification. So again, kind of have these smaller goals that will help you achieve your overall 5-year goal. So identify your first certification that you'd like to acquire, whether that is a med-surg certification or your CCRN or your PCCN, whatever it is, go ahead and identify that and work towards it. Number 24, get better at your SBAR report and also get better at your head-to-toe assessment, okay? I always tell my students, I can tell from across the room a strong nurse and a not so strong nurse solely based on their assessments. Number 25, again, find a mentor, okay? That can be me. I do offer mentorship, or it could be someone on your floor. Number 26, every time you walk through a door, say thank you. Thank you for watching this video, and here's to 26 goals for 2026.